Well, good morning. Good morning. This is Dr. Yonnette, and I am coming and checking in with you this morning as I begin my morning routine. I missed yesterday. Well, I shouldn't say missed yesterday. I deliberately did not go live yesterday so that I can give you some time to bond with your children, fathers, as we celebrated Father's Day, and bond with your family. And I hope you had a great Father's Day, especially for our first time fathers, Father AJ and Devon and Father Ben and Father Alan and all of you fathers out there who have been first-time fathers or who have been fathers for years, 50 years, 60 years, fathers out there with the most children. I hope you felt blessed and pampered. I had an opportunity to interact with a special group on Saturday and pamper them. We did a facial and we did a pedicure. And that was such a loving experience. But today I want to talk with you, going back to baby. I want to talk with you some more about how your baby should develop and grow. We're looking at developmental milestones in babies. And we're starting from 0 to 3 months old, very young, so that we can look at infant development and you can check how your baby has been growing and developing and see if it's happening as is outlined or expected. Let's look at vision skills. So, when your baby looks at you, does your baby really see you? That should be a big question that we will answer this morning. Now, your baby may look intently at highly contrasted targets. But when your baby is between the ages of 0 to 3 months old, they have not yet developed the ability to easily tell the difference between two targets or really move their eyes from one image to the next. They mostly focus, babies, infants mostly focus on objects that are 8 inches to 10 inches from their faces. So keep a baby's face close. You're talking about a little less than a ruler length. They're able to focus on objects at that distance. So mostly on their parents' faces. Because you know, as parents, when you pick up your baby, you're holding him or her right there up to your face and you're interacting. So during those first months of life, the eyes are now starting to work together and vision is rapidly improving. So eye-hand coordination begins to develop as the infant starts to track moving objects with his or her eyes and reach for them with the hands. By 8 weeks though, your baby should be able to focus their eyes on the faces of a parent or a person who is near to them. But for those first 2 months of life, an infant's eyes are not well coordinated, and sometimes the eyes may appear to wander or look crossed. But this is normal. This is normal. No time to become alarmed. However, if the parent notices, if you notice that baby AJ or Dominic or Mary or Jane or Maria is beginning to have their eyes appear as if it's turned in or out constantly, you need to seek help. Speak to your pediatrician and make sure that everything is fine. Babies should begin to follow moving objects with their eyes and reach for things around 3 months old. Okay? So your baby's vision, look for your baby's vision and the way it's developing. Now, a lot of times when we talk about vision, we think about visual. Now, vision and visual perceptual skills are two different things. When we talk about visual perceptual skills now, we are talking about how the child is able to make sense and interpret what they see And these skills, visual perceptual skills, include rather being able to discriminate or match objects that are the same. So I can discriminate between my mom's face and my dad's face, or the ability that your baby will have to remember the information they see. And you would suspect that this kind of development would come later in your baby's life. But you want to prop the experiences, provide the opportunities for this development to take place. So get close to your baby's face and look directly in his or her face. Be very expressive. Make funny faces. Encourage your baby to focus their visual skills. Position your face, like I said, 8 to 10 inches away from your baby's face. Sing and talk and do all kinds of things that will help your baby to focus. Choose colors. By the time the baby gets to about 3 to 6 months old, they begin to enjoy objects with increasing colors. At 3 months old, though, colors that you select for your baby should be light, cool colors like lemon and sky blue and lime green. But from 6 months old and the baby is now getting ready to see brighter colors. But we're going to stay within that 0 to 3 month old period. So remember, you want to expose your baby to different and enriching visual environments. If you usually have a seat in the den, try other rooms. Move your baby around the house so he or she can see different enriching environment, different views. And if you often carry your baby in a cradle through the house, use a different route to move the baby around. Sometimes put the baby on your shoulder. Sometimes push the baby in the crib or the cradle or the bassinet. Or sometimes, just take the baby in your arms. But give your baby the opportunity to develop those visual skills. So today we are talking about two important developmental milestones in your baby. Number one, we focused on how to help your baby develop vision skills, and we talked about vision being the ability to see. Vision is the ability to see things, right? So you want to check out your child's ability to see things. You want to encourage your child to see stuff in their environment. And then the second thing we focused on this morning is visual perception or visual skills, which is very different from vision skills. Vision skills is being able to see. Visual skills is being able to make sense of what you see, to discriminate, and to keep your skills, to use those skills for memory and discrimination and matching and the things that you need to make sense of your environment. One thing I want you to bear in mind is that you would notice that infants would have sometimes with their eyes would appear crossed, and that is normal. But if you see your child's eyes going outward or inward, and that's happening a lot, you need to speak with your pediatrician. Let them know that you've been seeing this happening. Let them just point it out to them so that they can give you advice, and you can target what's important to your baby at an early stage so that your baby can develop appropriately. Now, this is Dr. Yonnette. I wanted to share one last thing with you before I go. Every last Thursday of the month, I am going to present a hands-on class on helping your baby through the developmental milestones. And I want you to invite all the mothers and fathers and people that you know who have babies to be present. And I want you to be present with your baby as we do the activities together. I'm going to make an event and post it. And I look forward to you joining me on Facebook so we can have this time together with your baby. I am Dr. Yonnette. Thank you for joining me today. And I wish you a marvelous Monday as you continue to raise your child into the hero or shero he was or she was born to be.